Dr. Moneta, we're starting out with an acutely cold, painful leg. Referring back to these clinical signs and symptoms, those are signs and symptoms of acute lower limb ischemia. Is that right?
Yes.
And so when a patient presents with that type of presentation, is that when a clinician might suspect that somebody has acute lower limb ischemia?
Yes, you would.
And then would a clinician look then at the clinical signs and symptoms like we talked about here just moments ago?
Yes, you evaluate. Those are all signs you can sort of get from examining the patient and talking to them. And yes, you do all those things, of course.
And so the reasonably careful vascular surgeon, are these, when they actually see the patient, are these things that they're looking for?
Oh, absolutely. Plus, they're usually going to be doing other things as well.
And let's talk about what some of those other things are. You talked about pulses. Let's start on the left-hand side of the diagram. If somebody has an acutely painful leg, it's cold, yet they have audible arterial pulses, how is it that a clinician, somebody bedside, is able to hear the pulses?
Well, there's a little machine called the Doppler machine, and it's like a microphone in a way, and you put it over where the pulses, the artery, and it'll sense the flowing blood, and it translates the electrical signals from the Doppler machine into a noise.
Now, you said there are different categories of the condition that clinicians use. So if somebody's got an acutely painful leg, audible arterial pulses, and what category do they fall into for that?
If they have good audible pulses, it's not too bad. It may even be something else besides the arterial problem.
All right. And so when clinicians use the term a viable limb, what are they referring to?
That it's alive at the time you see it and is likely to remain alive.
So not in any immediate danger.
Correct.
Now, looking instead at when we've got inaudible arterial pulses, what's the next step that the clinician looks at in trying to determine whether a patient has got a more severe condition than just a viable limb?
Well, if they don't have audible pulses, then you proceed to the next things. Can you move your leg? Does it hurt? How much does it hurt? How well can you feel?
If a patient has limited range of motion, muscle weakness, is that something that would be a normal or abnormal physical finding?
Well, that's a very concerning physical finding.
And that's getting to this, paralysis that we talked about in terms of the signs and symptoms. Is that right?
Correct. Yes.
Okay.
That would be the
Right. So
red one there.
If motor function is intact, yet you've got an acutely painful leg, you've got inaudible arterial pulses, how do you all, as clinicians, categorize that type of acute ischemia?
Well, that is a situation where it may be arterial, likely is arterial, but it could be other things, because if they don't have a pulse. Sometimes people cannot have pulses anyway from chronic disease, but if they can't move their leg and they have abnormal sensation, that more implies an acute event, because you can't go along for a long time without being able to move it and have bad sensation without the leg dying.
What does capillary refill mean, and how does that relate to the diagnosis and treatment of acute lower limb ischemia? Well,
capillary refill is sort of a silly test in my opinion. You push on the nails, you see how long it takes. They blanch when you push on them. See how long it takes the blood flow to come back. And theoretically, it's a measure of how much arterial flow is in. It should come back quickly. If you've got good arterial flow, you push the blood away and let it come back. It comes back quickly. The problem is that it's very subjective, and sometimes you're just getting a venous phase, not an arterial phase, and so most of us don't use it much.
Okay. The term marginally threatened, what does that mean when describing a patient's condition who's got acute limb ischemia?
Well, I'm not exactly sure what that means, but it means that it's threatened, but maybe it's not as threatened as badly, I suppose.
Okay, all right. And so what sort of treatment options, or how soon does a clinician need to act when someone's got a marginally threatened limb with these types of signs and symptoms?
Well, all of these things, once you diagnose an acute arterial problem, you should act relatively quickly because you don't know what direction it's going to go. So even in this one, it should be treated promptly. Doesn't necessarily have to be treated within the next hour, but it should be treated promptly because it might deteriorate rather than get better or stabilized.
So when talking about the standard of care and what the reasonably careful vascular surgeon would do when faced with a patient who's got intact motor assessment, yet they have inaudible pulses and an acutely cold, painful limb, does it require prompt treatment, sir?
I think it requires reasonably prompt treatment, yes.
Yeah, okay. What about when we're dealing with someone who has, just walking through the symptoms again, a cold, painful leg, inaudible arterial pulses, but in this case, sensory loss more than toes, rest pain, and mild or moderate motor weakness? How does that situation compare to the other two that we talked about?
Well, that's an order of magnitude more serious. I mean, you've got that patient's leg is trying to die, and it will die if you don't give it some help.